About 20 years ago, I was managing the oncology pharmacy at UNC Medical Center. We wanted to make sure that not only did we provide the safest drugs to our patients, meaning the appropriate drug, but I also wanted to make sure that we had the safest environment for our employees. Data was emerging that through the process of preparing chemotherapy, small droplets was being released into the atmosphere, and those droplets were landing on surfaces all throughout the pharmacy. And unfortunately, those droplets, if not removed, would be exposed to individuals, would be tracked throughout the organization, and those droplets would get exposed either through breathing, through the skin, and would end up in the blood and the urine of healthcare workers. Data has demonstrated that if individuals are exposed to small amounts of chemotherapy over a long period of time, it puts them at risk for actually some type of cancer themselves. So we have employees that are trying to treat cancer by preparing drugs, but they're also being potentially put at risk. But unfortunately, you don't see those droplets being exposed. You don't see them on the surfaces. And so you don't know that you're at risk. And so it is important to determine and be able to test that contamination in the environment. And that led to the development of the ChemoGlow surface analysis test that we have that will allow one to be able to detect up to 5 drugs in 6 locations across your pharmacy. And so we developed this kit, and through doing it in over 14,000 wipes over hospitals all across the United States, we've recognized that it's not just about a one-time wipe, but you need to monitor over time. And those sites that we've evaluated that monitors over time actually have lower amounts of contamination in the environment. And it's simple. If you're aware of it and you understand the risk, you're more vigilant at trying to remove the risk and trying to ensure that you've got a proper environment that's decontaminated over time. And so in this setting, knowledge is power. And the more you test, the more drugs you test, the more locations you test, the safer environment you put your employees to ensure that they have the least amount of risk of being exposed to small amounts of chemotherapy over time.